Ailsa Rutter, Director of Fresh and Balanced North East. Looking forward to finding out what that is. And we have 20 minutes, colleagues, for this session, so Ailsa, if you could kindly introduce yourself for the record and add a sentence by all means if you wish to, but then we'll have plenty of questions for you. Thank you.
Thank you so much, and I'm absolutely privileged to be here and speaking with you this afternoon and speaking on behalf of the North East and the many partners in the region who are going to give you their overwhelming support for this absolutely crucial, once in a complete lifetime opportunity to take the single biggest impact to address the biggest cause of cancer in particular. For those of you who might not know who Fresh and Balanced are, we're a regional tobacco and alcohol programme based in the northeast of England. We've been going for 20 years. We're funded by our local authorities and our NHS trusts.
Okay.
And we're doing a lot of work to drive down the harms on both tobacco and alcohol.
Thank you very much. Thank you. Thank you.
Thank you. My first question is, what's the impact of tobacco smoking on public health? And then my second question is, do you think that the bill's measures to prevent vaping products to children will be successful, essentially clauses 61 and 62?
Thank you. Tobacco is devastating. It's devastating to every individual who dies way too young. It's devastating to the family who lose their loved one. And in my region alone, just since the turn of the millennium, 120,000 of our loved ones have died from smoking. And it's not an adult choice, it's a childhood addiction. And those smokers, the vast majority of them, reach a point where they deeply regret having got hooked in childhood. They don't ever think that first puff on a cigarette is going to be so addictive. And I think it's really important today that we remember the 6.4 million remaining smokers in the UK and the fact that 350 18 to 24-year-olds are going to get hooked to lethal tobacco smoking today. I'd like the committee to really imagine that cigarettes didn't exist. It's 2024, and here we are discussing a product that is designed to hook, to kill, to maim, to be completely addictive. And I think this discussion today needs to be about the future world that we want to strive for. We can talk a lot about how we're going to enforce it, etc., and that's very important. But for me, this is about imagining in 20 years' time, we have created an entire new generation who are going to be protected from this uniquely lethal product. So that is why, in the North East, the wholehearted support from all 12 local authorities, all 10 NHS trusts, our Integrated Care Board, which is the biggest in the country, our Association of Directors of Public Health have given a unanimous support in terms of the Stopping the Start and the Age of Sale of Tobacco proposal. In respect to the question about youth vaping, absolutely, we recognise that smoking is much more harmful than vaping, but vaping is not risk-free. But vaping is playing a pivotal role in our region with our higher levels of deprivation and addiction to get people off lethal smoking. That is not to say that we don't absolutely agree that much more needs to be done to reduce the appeal of vaping to young people. So we wholeheartedly and have responded to say we must address the inappropriate packaging that is too youth-friendly. Some of the in-store promotion, that's where children are really noticing it, is completely inappropriate as well. But we must ensure that we recognise that children are growing up within a family context. So children don't live in isolation. So the importance in our region also is sending clear messaging, evidence-based messaging, because we also can see the positive impact on children's health if we can get the parents and carers off lethal tobacco smoking and the reduction in second-hand smoke harm. And really importantly as well, more money in people's pockets, because of course cigarette smoking is such a negative thing on your income.
Minister Angela Lipton.
Thank you. Thanks so much for being here, for all you do in the North East, which is fantastic. Particular question, as you will know, smoking during pregnancy in the North East is some of the highest in the country, and I just wonder, do you think that this legislation will help to reduce those very high numbers? I think something in the region of 14% in the North East.
So we've made really good progress in the North East to reduce maternal smoking, and that's come through very good collaboration between our local maternity services with our local authorities, the fantastic leadership that we've had from key people in the LMNS, and with the direction of our Directors of Public Health. And I think with anything, there isn't one magic solution. It is about taking comprehensive measures. And the age of sale increase of tobacco undoubtedly will have a really positive impact to reduce maternal smoking. It also needs to be coupled with the things that are very important to continue to do as well. So we also really welcome the increased investment to stop smoking services. We hugely welcome, thank you, the reinvestment in the evidence-based health harms campaigns, and we're thrilled that nationally you're using our fantastic Smoking Survivors TV advert featuring Sue Mountain. It's also really important the role of financial incentives, for example, which we know have got a very strong evidence base, but I think this will have a positive impact on maternal smoking.
Thank you.
Thank you. Happy. Nikki Aiken.
Thank you very much. If there was one thing you could add to this bill, what would it be?
Gosh, well, I think there's some fantastic elements already in the bill, and I think the key thing for me is to make sure we can get this bill through, and particularly the focus on tobacco. And I think, you know, it's really good to think you're going to have subsequent consultation around the very important elements around vaping. I do think factoring in what colleagues previously said is we do need to have it simple mandatory age verification scheme. So I think that's already in place in Scotland. So I would certainly welcome that. That would also be introduced in terms of England.
Thank you.
Thank you. Trudy Harrison.
Thank you, Chair. And thank you, Ailsa, for all the work you do up north in the North East. I represent the North West in Cumbria, and we also have higher than average national rates of mothers that say they're smoking at the point of birth. It's about 12.3%. And in Cumbria, I'm told by our authority that it's about 3,500 hospital admissions, 74,000 GP appointments, 80,000 sick days, all caused by smoking-related illnesses. But why not just do more of what you're doing in the North East? Why do you really, really need this bill in order to tackle the problem?
So I think we're doing some really good work in the North East, but I absolutely think that this bill is required, because I go back to the point about the uniquely lethal nature of tobacco smoking. And I think this is the one key argument that I think we need to think about. This is guaranteed to kill. So for me, I think this is about a societal shift, and I am really pleased with the huge shift in the North East around the social norms of smoking. And we talk to people who smoke every single day, and they have your backing actually, because they desperately don't want their own children to fall into the same trap. And I think this is about aspiring, as I mentioned before, into the future. And we're all very conscious of the pressure and the strain on our NHS. And if we think about, you know, the impact 1 in 4 beds in the North East and elsewhere, you know, with somebody who's suffering from a smoking-related condition. So I think our NHS colleagues in particular really welcome this. The other aspect I think is very important if we think about the economic costs is we all get the healthcare costs. We also really understand the strain on social care. But actually it's business that bear the brunt from this, and that can surprise people. But it is about the lost productivity. It's about the people who are having to retire early, they're dying early. And I would just like to really think about who these people are as such. And I've mentioned Sue Mountain, I've mentioned her pivotal role and her TV advert being shown. But we've had so many other people come forward who sadly were diagnosed in their late 40s, women in the North East who are desperate to tell their story. So Cathy Hunt, 49, diagnosed with lung cancer. Claire Oldfield, 49, diagnosed with lung cancer. And their real appeal to you today is to think about taking this seismic leap forward in the leadership that the UK can show globally, actually, by recognising that smoking had a beginning, it had a middle, and it's down to us to say it can have an end.